Hello, I'm Assemblyman Dennis Gabersack, and welcome to Assembly Update. It's a new year, a new session is underway, and we hope that you'll join us every week as we bring in a number of topics that we'll be discussing here in Albany, and also a number of guests that we hope you find very interesting and informative. And speaking of guests, we have with us Anthony Bellani, who's back with us, I believe, for the third time. Anthony, welcome back to the program.
Thank you, Dennis. Glad to be here.
I know you, like I said, you've been here 3 times. You're an old pro at this. But the message that you have is so really very important, not only to the Western New York community, but to everyone in general. But before we get into what the Erie Niagara Tobacco Free Coalition does, let's talk a little bit about yourself. Give us a little bit about your background.
Sure, Dennis. I'm a proud, lifelong Western New Yorker. Was born in Buffalo, but grew up in Kenmore. And I raised my family in North Buffalo right now, a wife and 2 kids. And went to college here, got my undergrad at Buff State, my master's at Buff State also, for creativity, which is Buffalo's a great center for creativity. And I joined the Tobacco Free Coalition at Roswell Park 5 years ago, and really excited to be doing this kind of work with such great people. There's such passion and commitment at Roswell Park. Makes it fun and exciting to go to work every day.
Well, Roswell does such great work over there with the research and everything that they're involved in terms of their cancer research. I know they do a great job, but one of the components of Roswell Park is the Erie Niagara Tobacco Free Coalition. Why don't you tell us a little bit about what the coalition is and what they do?
Absolutely. In fact, we're here in Albany today as part of our annual visit to our legislators. We are covering every county in New York State with tobacco policy education. We have colleague organizations that work with the healthcare industry to help doctors and healthcare providers discuss cessation with patients and visitors. We have a component that works with youth. There's going to be some flash mobs all around the Capitol today calling attention to how tobacco targets youth. And maybe most importantly, actually based at Roswell, is the New York State Smokers Quit line. That helps those that need it the most get services to quit smoking, one of the toughest habits to break. And what the coalition does is, as you know, we go out into the community, talk with everyone from elected leaders all the way down to community leaders and citizens about the need for more tobacco-free outdoor space, things like tobacco-free apartments, which is very landlord-friendly, very business-friendly proposition. And now we're talking about the opportunity to reduce the presence of tobacco right at the counter in the stores that people go into so often, so that youth would have one less place to see tobacco as they grow up, and definitely drive down the number of youth smokers.
I know you and your organization have been very active. I know not only do we see you here in Albany, but we meet with you a number of times throughout the year back at the district office. I know you've been very active in the community in Cheektowaga and Lancaster and Western New York in terms of working with municipalities and different groups and organizations on different initiatives and things like that you have. I know you're working on some right now. Can you talk about what some of those initiatives are?
Absolutely, and that's really what makes the statewide tobacco control program special, is that we are local in every county. And as you know, we've built a great relationship with you and your colleagues in New York State. So we deal with local issues on a local level, and we don't come in with a edict from Albany that says you have to do this. We come in with our work plan, and we find out how a community is ready to act on it, and we work with them and we build relationships. And right in your neighborhood, we worked with Pyramid Development, which has the shops in West Seneca and most prominently the Galleria Mall. And their organization contacted us at a state level and said, we want your local people to help us develop and organize and announce a smoke-free policy so that their entire property, and you can imagine the property that covers the Galleria Mall all the way out to the edges, parking lot and everything, to go smoke-free. And we worked with them behind the scenes to successfully launch it last spring. and they've had nothing but good results from it. You rarely see people, if ever, smoking in front of the doorways at Galleria Mall anymore.
I know, as you said, even to the edges of the Galleria property, and when you drive into the mall, very prominently displayed are the signs. So you know it's a reminder that it is a smoke-free property, not only in the parking lots as you drive in, but also as you go into the mall, the various access points. They have the signage announcing that it is a smoke-free area.
That's really the goals that we're trying to achieve, and would we believe that Galleria Mall is 100% smoke-free every day of the year? I would say no, charitably. But the real story is that they're getting incremental success, as we are getting incremental success, and it's a massive cultural behavior change. Just as no one would think seriously about lighting up a cigarette indoors anymore, and your head jerks when you go to another state and see people smoking in a restaurant, that's how these things, pretty soon outdoor smoking near buildings will become that sort of same feeling of, why is there someone smoking in front of this door that I have to walk through and breathe the smoke?
I know you see more and more in large gatherings, for example, Rich Stadium.
All the stadiums.
Stadium,
the First Niagara Center did it last year. It's becoming one of those things, and now organizations are calling us because their health plan is letting them know that if they have less smokers on their rolls, less tobacco users, they'll find ways to reduce their costs. So they're figuring that if they eliminate the opportunity for people to run out and take those extra breaks that smokers like to take during the workday and have smoke-free campuses. So that's been a big success. We feel that we've kind of turned a corner. And tobacco-free parks has been another place. Your Lancaster community has been an early adopter. We're still working away with our friends in Cheektowaga. But
that seems to be a long process.
It is a long process, but that, again, we act locally, and we try and honor the wishes and goals of people in the community. But we know that we're going to be here for the long haul, and we feel that we keep chipping away, and we're there when they're ready to call us. And that's the good thing about our program. We want to keep being there when they're ready to call us. So the good news is that the counties have picked up on it. And under the Poloncarz administration and County Health Commissioner Dr. Gail Burstein and Health Director in Niagara County Dan Stapleton, both counties have adopted smoke-free policies for their county parks. So that's a big plus.
It is. Anytime you get an area where you're going to have children that are going to gather, what you want to do is try and keep the environment as clean as possible, as safe as possible for the kids, and that's one of the goals that your group works for and strives for, and you've really been, I think, pretty successful in the Western New York area and in being able to bring about smoke-free areas. And I think as each day goes on, I think you see more and more people recognize the benefits, not only in terms of health, but also in terms of the environment. There's a big plus for the environment also. So it's a multifaceted really approach that you're supporting and bringing forward to the Western New York community. Now, the governor later today is going to submit his budget presentation to the legislature. I know that in the past, the quit line that the state has done is receive funding from the state. It's always been a time where you kind of walk on eggs a little bit to see what's going to happen with the budget. Is funding going to be cut? I know that's very important to you. Can you just talk about how much that actually means and what that funding means?
Sure,
and
absolutely.
And the success that you've received with that?
Well, locally that the quit line that covers all of New York State is actually operated out of Roswell Park, another great success for our program and Roswell Park itself. And currently it employs maybe 30 to 40 people. When funding was at full speed a couple years ago, it was employing 60 to 70 people because the majority of the budget that went away was going for those types of ads that when smokers see them, they get scared and they pick up the phone and say, I need to do something about this.
And some of those ads, as you said, they get scared. I mean, you take a look at some of those ads that are playing right now. You see the woman gets up in the morning, puts the wig on and everything that she has to go through. I'll tell you, if that doesn't grab people's attention, I don't know what will.
We get some of the fallout that some ordinary citizens say, "Oh, I hate that. It scares me." And but the point is, we're aiming toward the people that need this the most, and it's the dyed-in-the-wool smoker that feels like they're going to take this awful habit to their grave, and many do, unfortunately. It still kills 25,000 New Yorkers every year. It's like people say, what's the magic cure for cancer? Today, the magic cure for cancer would be to quit smoking. 25,000 people would keep living in New York State if we were to do that. So if we get good news from the governor today, we live to fight another day, and we've seen other states that have had significant and severe cuts to their tobacco control program, and we've seen the numbers of smokers start to slow down, and unfortunately in some cases even reverse, because unfortunately the tobacco companies and their program and advertising never sleep. They spend $1 million a day in New York State just to make sure that their displays are in 16,000 stores across New York State. $1 million a day, that's about a month and a half of their spending covers our entire year's program. So
I know one of the things you also were involved in when you go into the stores was the placement of where the cigarettes are and the advertising, the effect that has upon teenagers, someone coming
kids,
in.
Preteens. The average age of kids smoking is about 13. So kids are seeing tobacco from a very young age. When they walk in the little backpack, and the kids notice everything. My kids are 9, 11, and you can't say anything to kids without them remembering exactly what they want to hear. So they notice the colors, the shapes, the brands. We've seen videos of 6 and 7-year-old kids able to tell what brand by what color. So it's no mistake that tobacco is prominently displayed in a store. The cigarette companies, the tobacco companies purchase that space and pay for it to the merchants to make sure that when was the last time, I'm sure still know some smokers, when was the last time any of them said, I'm thinking of shopping for a new brand? Doesn't really happen. Once you're a Marlboro smoker, you're a Marlboro smoker, et cetera, et cetera. Those brand walls are there to let kids know what's out there. And now that New York State has the largest tobacco tax, the highest tobacco tax in the country, tobacco companies have come up with other ways to sell low-cost access to tobacco. They've come up with the chew. They've come up with single-cell cigars, which are basically cigarettes in disguise. And on top of that, they add candy flavors to that. I don't know many people our age that are looking at peach-flavored cigars, but we know a lot of kids that like that. It's like gum.
Well, I know that's one of the issues that we've taken on. I know Amy Paulin, Assemblymember Amy Paulin, has legislation. We will continue to work and support yourself.
Be a great thing.
And hopefully the governor's message this afternoon is going to bring some good news
Let's hope
for your organization.
Always a pleasure, Dennis.
Tony, thank you for being my guest today
and great work
kicking off the new session.
Thank you.
I want to thank you for joining us on our program today, and with my guest, Anthony Bellani. We'll hope to see you again next week on Assembly Update. Thank you.